Welcome on to another installment of Medical Talk in Layman's Terms with Nurse Charlene. And I am your host this evening, Nurse Charlene. So, y'all, welcome on in and everything. So, this platform is basically something that was birthed a few years ago and stuff. And it's just trying to bridge that gap between healthcare and why did the doctors ask this and ask that and all that stuff. And I'm trying to bridge the gap between it, and terms that you can understand in simple terms. And so somebody that knows a lot of medical stuff, they may take it one way, but my thought is to get it on there, in that special way so that you can understand what's going on, how's it going, and what we doing here and everything and stuff. Welcome on, Miss Sandra, Auntie Sandra, and Auntie T. Get well soon. I send my love to you guys. And Auntie Sandra says, "Good evening, Nurse Charlene and Rosie and Britt." And they say good evening also, yes. And so they're saying it also. And welcome on, Auntie Rena. And definitely, I feel good. You guys came on nice and early and stuff. I'm just getting started. And yes, so welcome on. I'm going to say it one more time. Welcome on to Medical Talk in Layman's Terms with Nurse Charlene. And I am Nurse Charlene. And the topic tonight is stress, period. But stress, when your body says enough. Enough is enough. I've had it up to here, with that type of stuff. And that's where that comes from. And all of us have been in a situation where we've been stressed out. And some of us still are in a situation where you get stressed out. And so I didn't realize it before then that as I studied for this tonight's topic and everything, that it's everything that's happening with me, and different things. And so I didn't know that it would change me. It would change me. It would, some of the stress, it can make you sleepy. Some of the stress, it can make you irritable. And, every little thing, even somebody saying hi, why you say hi like that, and stuff like that, because you're stressed out. It messes with your behavior. It messes with your ability, your mood, and how you take things and all that stuff, So guess what? If you've been stressed out, ain't nothing wrong with you. You human. It's somebody, if you ain't never been stressed out, even as a baby, and stuff, something wrong with you. Something wrong with you. Because you're supposed to, be able to take a certain amount of stress and deal with a certain amount of stress. But this is serious, so it's 911 worthy. And I decided after my last podcast, I was so stressed out and trying to do the podcast anyway. It took my personality away. And so, I found out that it's really important because I could be a nurse and still be stressed out. I could be a regular, just a human and still be stressed out. It doesn't matter and everything. I could be grown up and still get stressed out. I could be a kid and still get this. So before I get started, because I'm ready and stuff, you see this board, it got some things on there because I had some things to say and everything. But, just read over that as you kind of go along with me and everything. This stuff is serious. Stress is horrible and it starts doing things to you. And you're going to find out tonight exactly what that, entails and everything. Welcome on, Auntie Barbara. I see you at least watching and stuff. You don't have to say anything. You could just kind of listen along. The topic tonight is stress. When the body says enough. I had enough of this, and everything. So let me read my podcast disclaimer. We're going to go ahead and dive on in. Okay. So this podcast is for educational and informational purposes only. While Nurse Charlene is a licensed registered nurse with extensive healthcare experience, the information shared here is not intended to replace professional medical advice, diagnosis, or treatment. Yeah, you can. Um, every person is different. What works for one individual may not be right for another. Always consult your doctor, nurse practitioner, or qualified healthcare provider with any questions you may have regarding a medical condition or before making changes to your health, your medications, or your lifestyle. If you think you may have a medical emergency, hang up right now. No, that's what they say though, actually, and stuff is hang up right now and call 911. I'm telling you the same thing. Get off social media and call 911 if you think something is happening to you right now as we speak. It's dangerous. We need you here for the next one and everything and all the other stuff that your family needs you here for. So you seek medical attention pretty much. The views shared on on this podcast are based on professional experience and general medical knowledge presented in layman's terms to help bridge the gap between healthcare and everyday understanding. By listening to this podcast, you acknowledge and agree that this is not a substitute for personalized medical care. It's not a substitute for your clinic that you go to and be seen at with your doctor and everything. No provider patient relationship is established. You are responsible for your own healthcare decisions. And remember, your body speaks. Your body is a snitch. Believe it. Listen to it. Respect it. And when in doubt, check it out with a medical professional. Thank you all for tuning in and taking a step towards better understanding of your health. Your health. Okay, welcome on in. Oh, Auntie Barbara says, hello, family and friends. She's saying hello to the family and friends on, even the ones, it's okay to just watch and not say anything. But if you want to, whenever you feel comfortable, you can go ahead and get on down. And so let me go ahead and put somebody on the podcast and everything. Yes, it's definitely something worth listening to because we all suffer and deal with this. And you could turn it up when you get in there. But all right, you guys and stuff. So we're gonna talk about stress. Oh my goodness. Ooh. I don't know why it visits me so much, but I think stress is in love with me and everything. So it likes to find me at just odd times, any time of the day, sometimes 4, 5, 6, 7, 8, 9 times a week, and everything and stuff. But we're gonna get through it because we always do. Okay. So welcome on in. So I say, I was thinking to myself, what is stress? Okay. Stress is the body's natural response to a challenge, a demand, a danger, pressure, or a major change. Disclaimer? Yep. I already did it. In simple terms, stress is your body's alarm system, your alarm clock and everything. Welcome on, Miss Sylvia, my God sister. She said, I am not going anywhere, sis. I saw my doctor already and I've had a colon test and I'm taking care. I'm sorry. I said, I think oh yeah, I'm taking care of myself. Thank you, Miss Sylvia. She said she taking care of herself. She not going nowhere because it's the stairways to hopefully heaven, and stuff. If we gotta go, but in the meantime and stuff, we don't have to go anywhere, prematurely if we pay attention and put ourselves first. It's okay to take care of the kids, the husband, the wife, and whatever and stuff like that. That's fine and dandy. Everybody, your brothers and sisters and everything. But at the same time, if you don't take care of you, I guarantee you they will still be here with whatever mess they're dealing with, and you'll be gone. You'll be gone and everything. Is that serious and everything. But welcome on, you guys and stuff. It's definitely this is one that for the books, and stuff. You guys watch the replay later, and I'll tell you all about that. and everything. So I did do that. So stress is your body's alarm system, in other words. When your brain believes something is threatening or overwhelming, your body prepares to deal with it. Your heart rate may your heart rate may start racing, and as your body gets ready, your muscles tighten up and you get that clenched jaw and stuff. Sometimes your breathing changes. It might get deeper or faster, and you're bringing in more air. It's not helping you just because you're bringing it in faster and stuff. It's actually causing some trouble, and it definitely changes. And then some hormones and stuff, such as your adrenaline level, makes your heart beat and keeps you kind of alert and stuff. The eyes get big, and everything. And this thing called cortisol is released. It's a hormone in your body, and that's what happens to us. So all these things are going down, and everything, and you're like, oh my God, because you're about to go into a mini war. You don't know what this is, but it's stressing you out. And if it got to the point of stressing you out, it's very important. You got to pay attention. Auntie Barbara said, self-care is very important. You are no good for nobody if you don't take care of yourself. Exactly. And my words exactly and stuff. If you don't take care of yourself, how can you take care of others? Welcome on in, cousin Tony. She said, hey, family, it's Tony. Yes. Welcome on in, my dear. We talking about stress. And God sister Sylvia said, kiss your mom for me. How is Rosie doing? Yes, she's doing just fine. She's actually on here with you guys, so she probably can read your comments, but definitely she's doing good. And yes, I take care of mom, Mama Rosie and everything, and she be going through it. Don't get it wrong and stuff. We be going through it, but this too shall pass, and we will just keep on striving, keep on praying, and keep on trying to do the right thing and snitching on ourselves, because our body is snitching on us, and everything, telling you something. Okay. So y'all welcome on in and everything and stuff. I want to give you some examples of when your body is thrown into stress, or you start feeling that way. It's you are driving and suddenly another car pulls in front of you. That's an example. You driving, minding your own business, staying in your lane, doing your thing, and a car just dip out in front of you. And what do? You supposed to say, thank you very much, right? Or do you say, I'm gonna kick that? Okay. We don't know what they got in there. They might have a gun. They might be jumping out from robbing somebody and stuff, and they just jumped out in front of you. Just be glad they didn't hit you and live your life. Because if you're ready to knock the hell out of them, I have been ready. I'm pretty sure other people, I'm not alone, but, you've been ready to, what the hell is wrong with, or something like that. Yeah, that comes out, but it's only natural. Just don't act upon it, because we don't know what somebody else is going through, and it's probably a million times worse. And they might act up what are acting up. And I'm like, I wasn't that bad. I wasn't that stressed out, and stuff. I was stressed, but come on, y'all, and everything. Welcome on in. Auntie Josie said, hello, everyone. Hope everyone's having a beautiful and blessed evening. And we hope you are having the same, a beautiful and blessed evening. Welcome on in, y'all. We got this thing going. We got it going on and everything. So I said the example of stress, this is just an example. You are driving and suddenly another car pulls in front of you. They don't even wait for you to pass by. They just jump in front of you like their time is more important than yours. I don't know what they be thinking, but yeah, they just did it. Okay. And then your body may immediately upon this happening, make your heart race, like, because it startled you and everything, make you breathe faster, like, oh, they almost hit me, and stuff. So you see what I'm saying? And so make your muscles tense up, like, oh my, and stuff, all those things happening all within seconds of this happening. You may start to sweat, depending on if they almost, and you had to slam on the brakes, and then somebody almost hit you from behind because they jumped in front of you so quick, And so all them things happening, and it may get you to feel scared or even angry, like I ought to knock the, and stuff. Yeah. And guess what? You're only human. Give yourself a break. And a pat on the back for not jumping out the car and running up to the other car and knocking the hell out of somebody or something like that, because that can happen too. And it has. It just didn't have good results. And you don't want that. Okay. And that is a stress response. Pretty much that. Somebody pull out in front of you and it startled you, and somebody else might have was gonna hit you from behind. So you mad at that. You mad at the car behind you too, because you didn't see that this car just jumped in front of me. And yeah. Stress itself is not always bad. Short-term stress can help you react quickly and stay alert, of course. The problem is when stress becomes frequent, severe, or continues for long periods without a adequate recovery, there goes your trouble, because it's going to start breaking things down. Your body snitches, so it's going to start giving you the clues, but what are you doing? Okay. So there's two different types of stress. There's one called acute stress, not because it's cute and stuff. It means right now, it just happened. It's not every day and stuff, but boom, you in it. That means it's right now. It's, and so the definition of it is short-term stress that happens because of a specific event, something that just happened, and that threw you into being stressed out a little bit, and stuff. You don't know how to react to it or whatever. And the examples is almost getting into a car accident. They jumped in front of you and you almost hit them, but you stopped in time, but you was kind of still pissed off because what could have happened, or something like that. Taking an important test. I'm almost a lawyer. I'm trying to take the bar. I'm studying, so I could take this test, the bar test, or for a nurse and stuff. I'm studying so that I can take this NCLEX test and everything. It's really important. Welcome on in, Rosie Granny Allen. She said, teach nurse, my. Amen. And welcome on in, Naima. She said, Antoinette, what happened to you in your life? Probably a person just like you. Exactly. Yes. Exactly. Something that just happened to you just suddenly. You don't have time to react because you didn't know it was going to happen in the first place. It's like, what just happened to me? It's really that bad and everything. Usually the body settles down after a stressful situation. When it's a short term, it just happened. That's called an acute stress. Chronic means over time. It takes a little while, and it's the same old thing going on, stress after stress after stress. You just can't catch a break and everything. And the definition of that is stress that continues for weeks, months, or longer. A lot of us in our jobs, if they're high demanding with a little tiny pay, or maybe it's high pay and high demanding and stuff, you're going to be on your stress table a lot. You're going to be going through something a lot because it's like it's right there. It's chronic, so it's every day. Expect to have stress, so you don't even think of nothing else. You're just going to keep on pushing in that area and stuff. But definitely, it's a big deal. And examples of chronic stress, which is the long term, it happens over time and it just continues and continues. That would be financial problems. You're adult now, you're adulting, it doesn't matter when you're adult and everything, but financial problems. I got to rob Peter to pay Paul. I got to, this bill always popping up. They done took that electric transfer out of my bank account and stuff, knowing I didn't even have that much money in there and stuff. And now I got to get the money to pay this because they just snatched it out and, things like that. So that finance problem, long-term caregiving, when you're taking care of somebody 24/7 and stuff. And after a while, you get stressed out because now it's not just a job, it's an adventure. Now it's every day. You just got to wake up on that road, and everything. difficult relationships, sometimes domestic violence, the wife beating up on the husband or the husband beating up on the wife or something like that, or relationships, with your siblings and stuff, and you fell out with this one and you might have fell out with this one, or you might be considered the black sheep or some of the family and stuff. But all these things, these are real things, and they do stress out the person, believe it or not. Even though that person might be wrong, or they might have already did all of these things and stuff, at the same time they get stressed out, so they lash out, and stuff. So it's a reason behind everything and every situation. And what else we got? Ongoing family problems. Yeah, like I said, the black sheep, but also, when somebody passes and she got mother's ring, or she got father's trophy or something like that. I wanted that, and and then it turns into a big old thing, and then family get to fighting, and family against family, and all types of stuff like that. And then also living in unsafe environment, like if you're unhoused, not homeless, but unhoused and stuff. This stuff, it gets bad and stuff. It's dangerous. I had somebody even tell me one day that the reason why they, poop sometime and pee on themselves and be real beyond, almost repair, is because it's a protection mechanism. They're trying to protect themselves from other people raping or abusing them in certain ways. If they're so far gone, they might be left alone with somebody that's clean and stuff, but unhoused on the streets and stuff like that. There's a good chance that that person is going to get attacked, and everything. So chronic stress is where the concern increases because the body may remain in prolonged state of alert. Like you got to come down off that alert. So acute is more right now, and then you recover from it. Chronic, it just keeps happening and happening, so you never come down from that first little situation where you were in it, and everything. You hold on to that. You got that heightened alert. Everything is messing with you, and now you're adding and adding and adding to it and everything and stuff. So it gets bad and everything. So what happens inside your body when you're stressed out? Okay, I'll tell you. When the brain detects a threat, it activates fight or flight response. Fight is your body prepares to confront the problem. It's gonna sit there and it's gonna say, "Hey, I didn't like that. You don't have to talk to me. Whatever it is and stuff. You sitting there. You're gonna confront the problem." Flight means that your body prepares to escape. I don't have time for this. I'm not going to do this with you, and stuff. You don't want the confrontation. You want to get out of here. So that's the flight. And then another one is called freeze. That's when your body can't even respond to it. You so shocked that person said that to me. My boss just chewed me out in front of everybody. And any other time I would have been like, I'll beat the, yeah. But you didn't do that. You froze. You didn't confront it. You didn't escape it and just walk away from it so that you don't even have to be subjected to this. You just froze and took it, or something like that. And that's also a problem, because then when you start playing it over in your mind, I should have just punched I should have, and stuff. So that's where that freeze comes in. The stress response for that is it can increase your heart rate, because you want to do this, but you like, no, yep, that's the old me, and everything and stuff. But also your blood pressure rises, your breathing rate, it increases, because now you so mad you can't even catch your breath. That muscle tension, that mouth that jaw get the clenching, and yeah, you ready, them that fist balls up, and everything and stuff. And then you got your blood glucose, because that gives you that energy and everything, and that adrenaline and everything. All of those, it's like, I'm ready to do this, but should I do it? So you're weighing the options, and stuff. So sometimes that freeze mode might come in, and then you're alert, because you didn't heard every word that is coming out that person's mouth to attack, in your opinion, you and everything. You're normal. You're normal. Stress hormones are useful when you need them temporarily. The problem is when the alarm system keeps going off, your body wasn't designed to live permanently in emergency mode, meaning not just ready for every battle, because your body can't do that. It would just wear itself down. So that's a dangerous place to be in, because it can start doing over time. It starts raising up your that blood pressure, and now you have hypertension, high blood pressure, however you want to say it. That blood pressure is up, and that's too much on you. And then other things it might start doing to start giving you those headaches, start giving you bleary eyes and stuff like that. The heart rate is up. It shouldn't always be up. Was you jogging? And stuff. No, this is something you feel like you're trying to protect yourself, but you can't always be in protective mode. You have to be able to jump to it when that time comes, but you need a reprieve in between. You can't just always be in jump to it, because after a while, jump to it doesn't work anymore and everything. So that's where I'm going with that. And so common signs and symptoms that you are stressed out. One is physical. That's something that you can actually kind of, I was going to say palpitate, like feel, and stuff, but it is a feeling, and stuff. And that would be physical symptoms would be your headache, that muscle tension, that neck and shoulder pain. They get so tight, they start getting a stiff neck, thing and stuff like that. Those things are going on. Your back is hurting, usually that lower back, but also up by your shoulder blades and stuff like that. That's where that pain is sitting in there, and it's like almost like a cramp. It hurts because you're mad. You're mad. You're angry. And sometimes you don't even have to be angry, but even if you ignore it and freeze and don't say anything, you still in trouble. Yeah, I didn't even trip. Yeah, you tripped. you wouldn't be human if you didn't trip off of it a little bit, and everything. But Auntie Sandra said, to help with stress, I find taking a walk or walking away for a minute. Yes, you got to try to find a way, find your happy medium. It's not always that, because it's not a one size fits all. We're human. So what I might do to fix me might not be the same thing you do to fix you and stuff. Cousin Antoinette said, yeah, because stress is real in everybody's life, and at some point and sometime. Yes, especially when you're raising a child or children in time. In this time, it can be very stressful. Absolutely. So if they real little and stuff, you got to take that time out and stuff, like potty training, and stuff like that. That might be a time where you could get a little stressed, because I'm tired of buying these diapers. I didn't know they had $1 million a package, and all of that type of stuff, crazy things like that and everything. So that's the child and stuff. Then you got your teenager. They want to vape and smoke weed and go to parties and kickbacks and drink and all of that stuff. You got plenty of time to be an old alcoholic when you get adult. You only a teen. You already tearing your body down early. It's fun, you around the peer pressure and everything. Y'all want to have, sexual healing, it ain't healing and stuff. You just have a baby early or something like that. I did and stuff. So I'm just saying transparency and stuff. But the whole point is, yeah, that's the teens, and then young adults. I got to go to the club at least once or twice in my life, and blah, 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 and such. And then you get to adulthood and stuff, I got to go out. I got to, so-and-so just went to Thailand. I'm about to go to Africa or something and stuff. I know how to fix that, and stuff. They ain't the only one making money and blah, blah, blah. And then you got your super grown or your grandma, grandpas, up there and everything. And, they're going through it and stuff, and they want to be known. They want to be heard. They might not have a companion and everything. So Cousin Antoinette said, teenage years, you can control them when they are little, but when they start growing up, that 12, 13, 14, and up. Exactly. Especially nowadays. Yes, because I heard they could call the police on us. How you gonna call the police on us and you doing wrong? Then you call the police because you know you're supposed to get knocked upside your head a couple times, and stuff like that. So it is literally that crazy, and stuff. So things like that, we wasn't ready for it. We didn't know that needs to happen. But guess who probably made them rules? Somebody that didn't get a whooping when they was in their teens or something like that, or somebody that made the rules, somebody that don't even have kids. How can you talk about it and you don't have no fruit on the tree? You're supposed to have some little, some legacy fruit, like a kid and stuff, or married to your partner, your husband, your wife, whatever it is and stuff, and they have some kids, and now you're there to be that stepmama, the stepdaddy, or whatever it might be and stuff. And yeah, in that case, but some of the people that make up the rules are usually the people that ain't even came across what you going through at for me, I'm just gonna use me as an example at work and stuff. They want you to write on those little whiteboards inside the hospital room and stuff like that. You gotta write your name and a date and all of this stuff and everything. But your name and date is up there from the day before. So it was 2 shifts that didn't write their name and the date and all of that stuff on there. And then now you stuck with it coming back to you, and they only catch you because you might be day shift or something. And that's when they work and stuff. What about the other ones? They were supposed to write their name on the board and all of that stuff. And so that's one thing, right? But what happens when everybody is saying that you ain't been in their room and stuff, and they want their medicine right now? Do you think I'm gonna write the name and date before I get that medicine? Yep, it's not happening and everything. But whoever made up that rule probably haven't sat there in the hospital room and looked at the demands and that patient calling on the bell all night long, and then all day long, all your shift long and stuff. Something is going down and everything. Yes, cousin Tony said right. Exactly. Yeah, don't talk about it until you already been about it and everything. And Naima says, I know I was stressing while my brothers won this year, won last year before they, I'm sorry, what did it say? Before lost 3 years, but I learned how to deal with it. Yes. Are you saying that you may have lost your brothers one after another and stuff, Naima, and stuff? Because that, if you're saying that's the pinnacle of stress. It's sorrow too, but stress is sorrow and everything. And when it's happening right after another and stuff, that's painful. It's like, oh my God, and everything. So it's definitely something you're really touching on it. And I thank you for even sharing that and everything. But yes, that's absolute stress. And guess what? You was normal for stressing over it. Abnormal. Oh, yes. Okay. And stuff. Yes. So she's saying that, with these losses and everything and stuff, she was stressed and everything and stuff. You don't, you got to give yourself always, never, because a loss never goes away. It's a hole that can never be filled. So how you feel it is you take care of yourself so that you don't, pass also, but also it's totally normal to feel that sorrow. And as long as you're alive, you'll probably feel that sorrow. You'll think about that person. You'll think, and then when they're coming like, in 2s and 3s and stuff like that, it's even worse and stuff. So definitely that's something that's a big deal, and stuff. A lot of us lose our parents and stuff like that. Don't get it wrong. You can't I pray for strength and this and that, and that's not the end of it and stuff. You got to pray for continued strength every day, because if you say it doesn't affect you, then you're not human, or something is wrong with you. Something is wrong, and it's a mental illness, because that's the only thing that can stop you from not caring and stuff. And cousin Tony said, yes, the loss of a loved one can be very absolutely, and we know and stuff, cousin Tony and stuff, and all of you guys and stuff. I'm not saying just us know about it and stuff, but yes, definitely we know that pain is cold and everything. Dreaming about them and all of that stuff, totally normal. To dream about them, to see a blue car and they had a blue car and stuff, and all of a sudden you crying and stuff, totally normal. Yes, really. Now, to the point of you want to walk out in front of a blue car and get hit, that's a little special. That's when you got to, really put your pieces together and everything and stuff. But that's totally normal and everything. Naima said, thanks for that. Absolutely. You are totally normal for feeling some type of way. Who gonna tell you how you feel? They haven't lived your life. You have, and everything. Nobody can tell you how to feel, or that's enough. It's been 6 months, or it's been 6 years. No, it could be forever until you go and everything. So absolutely and stuff. This is a big deal. I'm telling you now and everything. So when I said that about stress, it has different symptoms and everything and stuff. One is physical. That's things like headaches, muscle tension, stiff neck and shoulder pain, back pain, trouble sleeping, a racing heartbeat, and stuff. When something happens and you see something that reminds you, a song, and stuff like that and everything. Sweating, that stomach, bubble guts and stuff. That's really a thing. Normal. It's actually normal. Diarrhea or constipation, loss of an appetite or overeating to try to soothe yourself, rapid breathing. And stuff, not being able to catch your breath, feeling shaky, just feeling like your whole world is impending doom, and everything. That's the physical. That's just one of them and stuff for stress. Then you have emotional, irritated, angry at anybody, and stuff. Somebody, gets hit by a drunk driver or something that was speeding down the street and stuff. Now, anytime you see somebody speeding down the street, even if they didn't almost hit you, you ready to fight, you ready to get them. Like, I hope this happened, and stuff like that. Normal. Oh my God, normal and stuff. Then you got that emotional thing, that anxiety, always worrying about other people that don't have anything to do with you because it happened to you and your family member or something like that, or to you and everything. Feeling overwhelmed, feeling helpless. Like I just can't do nothing right and stuff. If I would have did this and if you would have did that, how you wasn't there, and how that couldn't happen to you, and you would have been the one taken out, and then your family member that would have still been here, and then they would have been feeling the same way you're feeling now and stuff. All of that stuff makes sense, and your mood changes, and then you got this thing called mental and cognitive. That's the symptoms where it's the way you think about things. Like I said, if I would have been there and stuff, this probably wouldn't have happened like this, and and stuff. You can't do that to yourself. You're hurting yourself and everything, and that would be forgetfulness. Where my keys at? And see, this is happening, and you're stressed out, and and that's what you're stressed out. You see what I just said? So forgetfulness, difficulty concentrating. You can't do what you used to do. You can't just settle down, because every time you get to yourself and get by yourself, that stinking thinking comes along, that rough thinking and everything. Normal. Oh my goodness, normal. Poor decision making. That might be something that you're gonna have to start. That you're making the wrong decision, and everything, like drinking and driving. But I need to drink because I need to settle my nerves. And no, now you're under the influence of something, okay, and stuff. Constant worrying, and somebody tell you to pray. I ain't praying. It didn't help so and so, exactly, and stuff. So then there's feeling mentally exhausted. I just can't. I don't know. What am I going to do? Like, yeah, normal. Okay. And then there's behavioral and stuff. Eating too much. These symptoms may change your behavior. Like you used to be on a good diet, and stuff like that. But now you're eating too much or you're eating too little and then you're just withering away to nothing. Sleeping too much or sleeping too little. Those are all signs, telltale signs. Even if it's not happening to you, it might be happening to your family member. So that's where that comes in at. And increase alcohol or substance use. It could be pills, it could be weed, it could be meth, and stuff. It could be whatever it's gonna be, crack, cocaine, alcohol, but more than just your regular glass here and there and stuff. But I'm talking about the whole bottle, and then you go get another bottle, in 30 minutes, and another bottle, until there's no more alcohol left in your house. So now you got to go to the store drunk to go get some more because you don't feel like you fixed yet, and stuff like that. That's where that comes in at. Becoming easily irritated. They just said, hi, how you doing? Why you need to know how I'm doing? I'm just saying. Losing interest in activities. I don't do that no more. I'm not going to Bible study. I'm not going to church study. I'm not doing that and stuff. Losing that interest and stuff that used to soothe you and make you feel good after you went over Proverbs or whatever, it might be and stuff. I'm just saying, and stress does not automatically cause every illness listed below, which I'm going to go over some, but prolonged stress can contribute to the symptoms and worsen certain conditions and affect your behavior and your body system that influences health and everything. So one is high blood pressure. If you get too stressed out, just stress alone is not the only thing that will make your blood pressure go shoot up through the roof, but it's a happy helper. It does help your blood pressure become unstable and everything. So high blood pressure means the blood pressure remains too high over a time period. It needs to be down a notch because it's wearing thin on your heart walls and stuff that pumps the blood to everywhere in your body. When it starts getting weak, then you start getting other problems and other problems and other problems. And now you got heart disease, you got congestive heart failure, you got coronary artery disease, you got all these things. And it started off with just the high blood pressure because you were so stressed out and you didn't find something in there to kind of lower it down and everything. So then now you're in trouble, and stuff. Not in trouble like, oh, you're going to get a whooping, but now your heart is in trouble. I'll take that back. Your heart is in trouble because of all the things that you do to try to soothe yourself. They might not be the right thing. Who has a book on it? Because nobody is the same person. They're not going to take the stress the same way. So that's where that comes in. So high blood pressure is one of the illnesses that stress can cause and everything. And so the moral of that story is to, try to stick with a healthy diet whenever you're ready to come down off of whatever's going on with you. The healthy diet, some exercise. And I found out just regular walking, you don't have to jog all over the world and all up and down the hills and all of that stuff. Just simple walking helps your blood pressure come down and helps you be a healthier you and stuff. A healthy diet, it definitely will give you the energy to get out there and walk and stuff. Weight management, if you're a lot bigger, and stuff, is going to take a lot more to get you out there than it is if you were smaller, but not so small that you're unhealthy that way also, because it's a such thing as being underweight. And it's a such thing as being overweight. You want to try to hang out and find your middle of that and everything. So then we got definitely getting some sleep. You're not supposed to be up at 3:00 in the morning in the middle of the night at the midnight hour and stuff. You're not supposed to be up unless you work the midnight hour, the knock shift, and stuff like that. But other than that, you're not supposed to be awake, wide awake with your eyes open, and you got to get up at 5 and go to work or something. Mama Rosie said, "All right, now say that. That's right. You can't be up in the midnight hour and you day shift or something like that." Stress management, how to manage the stress so that you can recover from this and everything. That's some things. There's other things like heart disease, which is chronic stress can affect your cardiovascular system, which is your heart system. It just had the cardio is the heart and everything. That's all you need to know, the heart and the artery system. And it may contribute to unhealthy behaviors like overeating, eating the wrong thing, not a healthy diet, but a bad diet, a junk food diet and stuff like that. You just mad at the world and everything. So Naima said something. Let me see. Miss Naima said, my brother did that lots before he passed away, drinking. He told me that all the going to do until he passes away because his mother passed. And man, I know I was so worried about him. He just passed July 10th of this year, and he did it bad. God be with him, and just praying on it. Continue to pray for him. Continue to pray for him, even after he's gone and stuff, definitely. And yes, guess what, that his stress from losing y'all mom, that turns around and becomes your stress. Now you lost your mom and you lost him because he was like, he gave up on himself. Now, sometimes that's the extreme manners, stress, when you give up on yourself and stuff. Yes, you're not going to do the right thing. You're not going to be like, I give up on myself, but I'm a jog every morning before I go to work. And stuff. I'm going to eat a healthy diet with no fats and low in sodium, low in sugars, and stuff like that. Yeah, you're not going to do that because you're trying to get out of here. And so all the right things to do that he might have did in his life and stuff, now they're going to be the wrong things because he's hurt and stuff mentally. He couldn't deal, and stuff. And people are like that. A lot of people are like that, including the one you're looking at on the host is like that, and stuff, feeling like, oh my God, and stuff. This stuff is real. It's painful. But remember, at the end of the day, even your brother, he's only human. And so it was the way, if God was to step in, and the way he was receiving it may have helped and everything, but it's nothing. It's not a failure on you. It's not even a failure on him. It's just that we deal with so much that is just so painful. It's so it's so everything, that yeah. It's just a matter and stuff, sometimes we could get lucky and intervene, and sometimes it's nothing you can do about it. And it was nothing that if it was, you would have fixed it, so it's nothing on you. It's called being human, believe it or not, and stuff. And it's that bad. And stress causes or it makes these things worse. That heart disease, that high blood pressure that turns into the heart disease, being at risk for a stroke. You have too much stress on your hands, you can actually have a stroke. And it's because of all the things that are happening in your body. Your hormones change, your cortisol levels rise, and all these things and stuff. And so I would be wrong if I didn't go over this real quick. But, if you find yourself in the middle of seeing somebody that's having a stroke or something like that, or you find yourself, going downhill and stuff, these are some things that you need to be ready for. It's called BEFAST, BEFAST, and that will be for a stroke and stuff. And that will be, B is for balance, sudden loss of your balance. E is for eyes, blurry eyes, or they're floating around and stuff in there, and stuff. Something is going bad and stuff. And you can almost feel it, and everything and stuff. But that's the B fast. So that's B. And then fast, FAST. F is for face, facial drooping. That's one side going down or the other. It don't matter which one is going down, like a melted candle, just melting down and everything. Then you got your arms. They tell you to put both your arms up ahead of you and stuff like that. If one is drifting down, that might be the one that's being affected by an actual stroke going on. And then there's so face, arms, and then speech. Slurred speech. It feel like your tongue just got really big in your mouth and stuff, and you slurring your speech, or you can't even talk at all. And so you can't tell nobody. You just pointing to it like, yeah, tell them 911, or something like that. But it's that serious. And then last but not least, fast is time. Time to call the emergency 911 and say, I think it's a stroke. She's having all the symptoms. He's having all the symptoms of a stroke and everything. So time is brain. How much can they recover from your brain? And if you get in there, I think it's a 4-hour window. It might even raised a little bit, but most likely it's that 4-hour window and stuff. And that means if they get you there from the last time you were normal and stuff, you get inside that ambulance and get to that hospital, they can CT scan you, run these blood tests, do all these things on you, your EKGs and all of that stuff, and you might qualify for this clot buster that they call TPA. And y'all don't need to know the name, tissue plasminogen antigen, but TPA and stuff, and that medicine can break up the clot right away, and then you recover from it. And so the deficits that you did have, they can slow down a little bit, and so then you won't be just totally paralyzed, or you won't stay paralyzed and everything. But if you don't get it in time, it can take you out, all the way, take your life, or it can take that whole side of you, depending on what side it was on. So that I just thought that I might as well, if I was mentioning stroke, that I mentioned that to you. We're talking about stress tonight, but stress can help speed along a stroke. So just remember that when you're worrying, when you have that anxiety and all of that stuff, that this can happen to you and stuff. Then there's things called, I had an anxiety attack. I just feel like I was running. I was, still and everything. It's excessive anxiety is excessive worrying, a racing heart, trembling, restlessness, difficulty concentrating. You just worried, impending doom, muscle tension, and all of that, trouble sleeping. You can't even sleep and everything. If you don't find a way to solve that, and you bring it into the sleep with you, and then wake up and it's still there and stuff, you're going to be in trouble. You might not last. You can die from it. That's why I'm speaking on stress tonight, because we can die. We can die from it. You and me, and everything. Man or woman, it doesn't matter. You can die from it and stuff. Mama Rosie said all of the above. Real talk. That's right. And everything. And then the treatment is, of course, you got to get you some counseling and stuff. I would even add in church and counseling, and stuff. Get a little bit of both, spiritual and the other kind of counseling and stuff, because you never know which one, or they might both just bless you together, and everything. But that getting that sleep and stuff, you gotta start taking care of yourself. Give yourself grace. It's only gonna be one you. And after you're gone, there will never be one exactly like you. It might be another man. It might be another woman. They might even look like you, but they is not going to think like you. They are not you and everything. So that's a big deal. Naima said, I used to ask him, why do you drink every day? And it was because he missed his mom. Yes, your brother and stuff. That's a tough one too, because how can you stop him from missing his mom? It's what she did with him when he was born. It was the conversation that you might not have been privy to, even though that's your brother and stuff. Whatever she did with him, the way she held him, the song she sung to him, and stuff like that. And so when you lose that person, it's like he felt like he lost his whole world. No, nothing else can compare. D. Barbara said facts. And Mama Rosie said all of the above. I see now and stuff. And this is real. This is real. It's called stress. But stress can cause you, can take you out of here and stuff. You can, it helps your depression. That's why they give you all them little questions or questionnaires when you go to the doctor. Auntie Rena said, that's right. Yes, that's stress and stuff, because everybody takes their stress different. Everybody goes, I don't know. I'm not worried about nothing. I'm too blessed to be stressed. Well, you know what? Nobody said that just because you're blessed that you would never stress. So that's even wrong. And it's wrong if you take that model and just stick with that. Maybe blessed in a way that this, but you never know until stuff start getting taken from you that you thought you would never be out of. I thought I'd never be out of money and stuff. And now you at the food pantry getting you some free food, or something like that. Don't get it wrong. Yes. And then the treatment, psychotherapy, the treatment, medications, exercise, healthy diet. And all of these are some of the main things you could do to try to stay here longer and stuff. I didn't say it would fix it, but Tylenol ain't never fixed the headache if you don't know what the headache is from. Pepto-Bismol ain't never fixed bubble guts and or healed them where you'll never get bubble guts again, because it doesn't know. It's treating a symptom and everything. And that's all we can do is treat the symptom. Treat what your body is snitching, that headache. But why did you get the headache? You just took the Tylenol, but why did you get the headache? You got to find those things out. You got to be Columbo. You got to be Sherlock Holmes on your own body. Why did you get the earache in the first place? What did you do? Okay, you were swimming and too much water got in your ear or something like that. But why did it happen in the first place? That's the whole point and everything. Welcome on in, my dad, Mr. Buckner and stuff. He said, yes, 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 that's right and stuff. Insomnia and sleep problems, stress causes these things to be worse. So you can't get no sleep, or you up at what I said, 3 o'clock in the morning, 4 o'clock in the morning, 5 o'clock in the morning, and you got to get up at 6 and go to work, and stuff like that. And it's like, yeah, I didn't get no sleep. Now you tired and you grouchy and you want to knock the heck out of somebody that they keep on asking you stuff because they got their sleep and you didn't. But why you didn't get your sleep? Yes, Naima said, thanks for all the information for stress. Absolutely and stuff. This is what I'm doing. I'm trying to bridge that gap between being here, just being here and knowing this medical stuff. They should never be able to say the elemental P of the QRX of the TUV, and stuff like that. They should never be able to say that. And you leave the doctor's office not knowing what the heck do I got? What is wrong with me? The doctor ain't supposed to know. He ain't going home with you. He ain't going home with none of them patients, and stuff like that. So this is where it's coming in at. We got to stop being scared of the doctor and get out there and fix us, because that's God made the doctors. He put breath into their body and stuff. So they ain't nobody special like that and everything. I see 2 questions. So cousin Tony said, yes, cousin, educate us. Thank you so much. Week after week, you bring so much knowledge that we can take and use for our own self-benefits. Thank you. And thank you for getting on and putting yourself first, and everything. And remember, I said, just because you might not be stressing today, you might can help your neighbor. You might can help your child. You might can help your spouse, and everything and stuff. So this is definitely something that's needed. But guess who else helped themselves? I'm stingy. I help myself by doing this. I'm going to do something. If I feel like it's a lot of stress going on in my life, I'm about to teach on it because I study on it, find out how I can stay alive a little bit longer if I do this, this, and this. And then I give it to you. And stuff. That's called paying it forward. It's a gift. I got 22 years of registered nursing, and then 34 years of just being in the healthcare field as a medical assistant, a nurse's aide, medical office manager, a certified EKG technician. So I got a whole bunch of I put my irons in every fire and stuff, and became the firefighter, the lawyer, whatever I had to be, that's what I became for myself so that I could still be here for my family. Now, if I go anyway, we all got to live and we all got to die, and stuff at the end of the day. But how are you going to die? Are you going to force it? Are you going to speed it along? What are you going to do? Are you going to be the one driving up and down the street and stuff at 100 miles per hour? And Naeem, I see what you said. How often are you live and stuff? And that is unless there's something, because life's on me too and stuff. Unless there's something going on and stuff, which I'll announce it on Facebook. I'm a public figure on there and stuff. But I'm on every Tuesday starting at 7 p.m. and I go to about 7 to about 8:15, 8:30 at the latest, and that's because I want to finish it off and everything. But other than that, I'm on every Tuesday, once a week, and I give you everything. I talk about everything. If there's a part on your body, I talk about blood pressure, I talk about diabetes, I talk about stroke, I talk about heart attacks, I talk about the different heart diseases, I talk about mental health, I talk about drugs, I talk about sexually transmitted infections or STDs. I talk about, if it's something to talk about, I talk 420 and stuff. Sometimes I'll talk about weed. Is it medicinal still or is it recreational? And stuff. Is it cute and fun until you get gastroparesis and your stomach is paralyzed and everything you eat you throw up, and stuff, that it's really a thing and stuff. I talk about it all and stuff. There's nothing that I won't touch. I talk about sickle cell. I talk about autoimmune disease. Anything you could think of, I talk about it. What is rheumatoid arthritis? What is the bones and the joints and the ligaments? I will talk about it. So it depends on how the temperature in the world is going when I pick the things, or you can just message me or something like that and give me a topic, and then I'll let you know when I go on with it and everything. So yes. And Naima said amen for you. Bless your heart. Amen for you, because you putting yourself first by getting on, because this is the actual movement. Medical talk in layman's terms with Nurse Charlene and everything. Stress can give you digestive problems. That's why you get what we call the bubble guts or diarrhea or constipation. You can't even go at all. You get dehydrated and stuff. All these things from just stress. It speeds them along and makes them worse, because it'll make you not drink, not eat, and different things like that. So yes. With Miss Naima said, thanks. I'm gonna be looking for you again. All right, that's what I'm talking about. Come on in, baby, and stuff. So then it helps destroy you, like diabetes. Diabetes is bad, the blood sugars and stuff, because it can get so bad that you start getting things amputated, like your toes or fingers and stuff like that, when diabetes goes wild, and stuff like that. But with stress and diabetes, you just double the chances that something really bad is going to come out of it and everything. So it's literally that bad. Your immune system, the system that fights your immunity, you have to have an immune system so you can fight off toxins and things that are trying to attack your body, like the flu, like the colds and all of that type of stuff. And if they already got beat up, guess what? They can't fight when you get sick again, and they haven't made up yet, and everything. Stress helps your immune system go downhill and everything. So that it just dabbles in so many things that it's like, well, what do it help with? It don't help. It destroys you, and it just keeps getting worse and worse. And guess what? It affects children. Stress affects babies, then your children and adolescents, then your teens. Stress Stress. I'm not that pretty and I like so and so, but he like only the popular girls, or she only like the popular guys, the jocks and everything, but I like her, I'm in love with her, all that stress. Yes. Young adults. Well, now I could drink, legally and stuff. So now I need to be at the club. And then you develop alcoholism problem. Yeah, that's fun, huh? And you can't pay your rent because you drinking and driving. You got DUIs, and you ain't even made it to halfway through your life. And then and then the adults that's really adulting. That's the next size up, and that's your adults and everything. And then the older people and stuff, who gonna take care of me and stuff, if I get dementia, if I get this, if I get that. You see where I'm going with this? It's stacks on top of stacks on top of, so every age group can get it, from that child, that baby, to that child, to that teenager, to that young adult, to that middle-aged adult, or over 36, and then to that senior citizen, and everything. We all got the problems. We all gonna have stress, and it's gonna be different stress. It's more widely ranged within your age group and everything and stuff. And then trying to find out, what do? I hate computers and stuff. They didn't have these when I was growing up and stuff. We had to write this stuff down and have a list and stuff. Well, now you got to get with the times, or you're going to be lost. We're on social media doing podcasts, and stuff. You got to get it. You got to get in there and stuff. So that's what I'm trying to say. It gets crazy and stuff. And then another one, I want to do this because my LLC is Your Body's a Snitch, Believe It. That's my LLC. I'm the CEO, and it's right under my name, Nurse Charlene and stuff. So I wanted to tell you, stress management in snitch terms. So S is stop, pause, and recognize what you're feeling. Okay, that's the S. The N is notice. Pay attention to your body's warning signs. The I, identify the source of the stress. Why are you so stressed? Because you might be able to get some help before you meet your demise, or you pass away from this, because you can't think any other way and stuff. Just identifying it might help you turn the corner. It's not going to stop you from being sad, from another loss, but it might help you turn the corner. And then T, take action. Choose one healthy action you can take, like changing the diet, eating if you stopped eating, stop eating so much if you overeat. You see what I'm saying? Then C, communicate it. You got to tell somebody. You can't do it all by yourself. If God made that, then he wouldn't even made doctors. If you could fix yourself and heal yourself and everything. Rosie Granny Allen said, great podcast. Keep it up, Nurse Charlene. Much love, mommy. I love you, mommy. And she also said, love the board behind, because that's not up there just for nothing. If you're able to take a picture or just really get a chance and pause it on the replay and read that and stuff, it got some out of sight things on there, and it's all you and what you're going through and everything. So I said, communicate. You got to tell somebody. You might need some actual listening ear to help you bounce some of these ideals off of them. And then there's heal, and that's the last of snitch and stuff. And that's heal. Give your mind and body time to recover. You are human. You are human. You get a chance to get a reprieve. Yes, it's still gonna hurt. Yes, you still gonna cry. Yes, I'm still hurt behind things that happened years and years ago and everything. But at the same time, you can get some help if you really want it. Give yourself a break and stuff. It hurts and stuff. So give yourself a break. Do you know you that important to just think about all the people around you. Just take a 360 of all the people around you. What would happen to them if you're no longer here in their life? Exactly. So when you look at that, before you do things that might speed up your demise or speed up your death, and stuff like that, look at that. and stuff, that you're important to somebody. Somebody needs you. Now, if you can't help but to go, your disease process has doubled up, and it's at the end now and stuff. You got to go. At least you can't be stressing and go home to meet Jesus. So you got to get yourself together also. And a lot of people wonder why, once that family is mended together and they're all together and stuff, that person goes ahead and lets go and gives up the ghost and stuff. It's a reason why they did that, because they knew that you could make it and stuff. So that's the other difference and stuff. It's hard, but it's the truth. It's the truth. So I'm gonna finish off this podcast and everything, and get you guys on into something else and stuff. But don't forget to watch the replay and everything. It happens about 2 or 3 minutes after I get off live and everything. You'll be able to go back and watch the replay, anything you missed and everything. And also, I'm streaming live from Facebook Live and YouTube at the same time. So everything you see on here, if you're my friend, or you could go on Facebook and find me under Charlene Nurse Allen, and it's a public, so nobody is blocked or anything and stuff like that. But also, if you don't want to do that and you want to go on YouTube, you go to YouTube. Up in the search bar, you put Medical Talk. It's a long one. Medical Talk in Layman's Terms with Nurse Charlene. And you'll see all of mine from years ago and everything. You'll see all these different podcasts that I've done on different things, and you could thumb through those. But also, I'm going to be doing a lot of repeating of those topics when I see fit that somebody really needs that information and stuff. So I thank Naima for getting on here and checking us out. We got a new family member, guys, and stuff. My auntie Josie, my auntie Barbara, my auntie Sandra, my mama Rosie, my daughter Brittany, my dad Raymond, or Mr. Buckner, and all these people coming on and stuff. If I missed you, I didn't mean to miss you, and everything. I'm saying that all these people, they're very important. I send my love to all of them, and as you come on little by little, it's okay and stuff. But this is some good stuff, huh? Oh, my auntie Rena, and even her twin Drina. My son Michael, he gets on and everything. My cousins, Antoinette, different ones and stuff. You get on and stuff, and then somebody that knows me well, I'm gonna put it on display. She said, my auntie Barbara said, "Love you, Bubbles." If you don't know about that, now you know. I had to come up with a way to entertain myself. So I guess I used to, when I was bassinet worthy and stuff, I would play with my spit, and bubbles used to come out and float up in the air and stuff. I was the first bubble machine or something like that. So that's what they called me, Bubbles and stuff. But that's a term of endearment, and I'll take it with me anywhere I go. And people that really, really know me know Bubbles and stuff. But thank you and stuff. But if I forgot any names, it was not on purpose and stuff. I thank you all. I thank you for your time, taking that time out on a Tuesday evening to see what I'm doing here and everything. And Cousin Antoinette said, as always, Cuz, great job. Thank you. And I love you. And good night. Good night, cousin and stuff. I'm just finishing up the last thing, which is your take home message and conclusion. So I'm going to read that real quick and stuff. And then I'm going to let you guys go. I promise and everything. And it goes like this. Stress may start in the mind, but its effects can be felt through the whole body. Listen to your body when it starts whispering. I'm tired. I can't sleep. My heart is racing. My stomach is upset. My head hurts. I can't concentrate. I'm constantly worried. I don't feel like myself. Those signals deserve attention. Your body is a snitch, believe it. Your body may be telling you before your mind admits it that something is wrong and needs attention. And conclusion, Stress is a normal part of life. It is normal. You don't have a disease or something like that. It's normal and stuff. So stress is a normal part of life, but living in constant stress should not become your normal life. Your body has an alarm system for emergencies, but the alarm was never designed to stay on 24 hours a day, 7 days a week. So learn your warning signs, protect your sleep, move your body, exercise, eat and hydrate appropriately. Talk about talk about what you're experiencing. Set your boundaries, ask for help, and most importantly, don't wait until your body screams when it has been whispering all along. Your body's a snitch, believe it. I am done for this evening. Thank you all for coming out, choosing yourself first. And remember, no matter what the topic is, just go ahead. It's worth a listen, because even if it doesn't suit you at the time, you're not stressed out, that's good. But there's somebody in your life that's stressed out. Now you got something to say to them. You can't just say they're there. Well, I'm too blessed to be stressed. I don't know about you. You know what I'm saying? That's condescending and everything. So just remember, you can help somebody else by something that you pull into your psyche, and then you can have the right words to say to that person. I just listened to somebody that just broke down stress very well. And therefore now I see why it's so important that we don't be constantly stressing every day, because a new thing is going to come and a new thing, and they get dangerous. And guess what? Them hormone levels be so high that the next thing you know, you in a hospital and you didn't drop and you don't know how you got there. It's that bad, and it's that 911 worthy and stuff. You take care of each other and take care of yourself first. Self-care is everything. And take care. So good night, everybody. Thank you for all the participators. Thank you for everybody that even watched, that's participating. And I send out my love. Take care of yourself and each other, okay? And my god sister Denise Ray got on. She said wonderful info. I caught the last. Sorry I missed so much. Still very helpful. No worries, because 2 to 3 minutes after I get off here on live, you can go back and just go to my page and click on it, and you will be able to find it from the beginning. And you just won't have me interacting with you, but that's okay. I'm interacting now. And thank you, Naima. I look forward to seeing you again, and I'm gonna come up with some good stuff for you and everything. Yes. So thank everybody and stuff. Bless your heart, and y'all take care of yourself, because we only get one of you. You only get one of me, so it's important. Take care of yourself and each other. All right. Bye-bye. Yeah.